This is the big one here. We've managed to enjoy and be educated with several. I think this is number 6 conversation with Betsy McCaughey, who former Lieutenant Governor of the State of New York, and the individual specifically responsible for, in my opinion, all of the heavy lifting, all of the great information. She's a patient advocate. She's founder of Committee to Reduce Infection Deaths and so on. And you can go to her website at defendyourhealthcare.us. Or you can listen to her right here on WSTD. Betsy, welcome back. How you been?
It is so nice to be back with you again.
You are terrific. I wonder if you'll help me out here. I think I found something. I think I found something that is kind of like the mother lode, and you're responsible for this. That if the knowledge of this was ever focused upon and put out there in a nice bite-sized chunk, all of this debate and rancor and so on. I mean, it may be one of the reasons, if not the reason, why some of these Democrats specifically are so gaga about the reaction they're getting from American people not being able to understand what is your problem. It started, at least in part, with the reaction to Sarah Palin's reference to death panels. There's nothing there about death panels, nothing there. The AARP put out a bulleted letter that said there's nothing in this legislation that requires euthanasia and yada, yada, yada. And it got me thinking about your piece the first one I read was June 8th in the American Spectator, Downgrading American Medical Care. And it's there that you reveal, and I think you're the only one who has done this, that the real sinister aspect of this thing was, as you point out, slipped into the stimulus bill, the last place, H.R. 1, where anyone would be looking for something nefarious as it might impact health care.
That's right. Actually, there are 2 provisions in the stimulus bill that are very damaging to your health.
The Federal Coordinating Council for Comparative Effectiveness Research, that one there, and then the other
National Coordinator of Health Information Technology.
Right, and then and subsequent to that, he took Blumenthal and Ezekiel, who were advisors, and put them in charge of the actual council. There's like $1 billion already funded for this. The analogy I used was that, and one of the reasons I think the Obama folks are getting their panties in a lot of all of this is that it's like you've got the keys to a brand new Lexus, but you don't have the Lexus. You know, I've got the key because without those 2 provisions, please correct me if I'm wrong on this, and I'll be appropriately embarrassed and discredited. But which is all right, you know.
You've clearly done your homework. You are always so well informed.
I appreciate that. If these 2 provisions had not been put in the stimulus program and did not exist at this time, then all this business in H.R. 3200, which I think is going to be the model for everything that comes forward out of this out of Congress, would be a lot more benign because they wouldn't have the facility. Then this is what creates the ability of the government to this. Yeah, this is what allows for the rationing.
That's right. This is the framework. First of all, no one can argue with the fact that it's good to have computers. And the medical community is way behind many other industries in using using information technology. So I'm glad to see that more and more physicians and hospitals will be using electronic technology, because the fact is, if you have to be rushed to the hospital, it's good if your health records can get there ahead of you, especially if you're in the emergency room. But that's not really the purpose of this health information technology. The bill makes it a goal not only that every medical treatment will be entered into this national electronic database, but more importantly, that doctors will be receiving via this electronic system protocols on what the government considers appropriate and cost-effective care. Not just informing them about the latest research. That in itself would be a good thing. No. Protocols that they must follow, because if they are not meaningful users of this new system, and that definition is left entirely to the Secretary of Health and Human Services, it's totally discretionary, doctors who are not meaningful users of this system will be punished financially through Medicare and Medicaid. And so, just to fill in the blanks, Dr. David Blumenthal, appointed National Coordinator of Health Information Technology, wrote in the New England Journal of Medicine on April 9th that yes, indeed, this system was not just to make your medical records more convenient for you. No, the purpose is to instruct doctors. He calls it clinical embedded decision making, but let me translate it, means computers telling your doctor what to do. and the information for that will be coming from the federal government. So, and he predicts, by the way, in this article, that doctors will resist this loss of their ability to prescribe what their patients really need. He says some doctors are going to petition Congress to repeal this bill, and others will simply reconcile themselves to facing the penalties rather than deny patients the care they need.
And Dr. Frazier, in my interview with him in the last half hour, an anesthesiologist down in Indianapolis, pointed out that that if this thing went through, and it went through the way it is, and then they start going for all their savings, which are going to come out of lower Medicare payments and putting basically everybody on Medicare, he said this will create a serious access problem as more and more doctors just say, the hell with it. They go
serious
gold.
Access problem in two ways. Yes, many fewer doctors will be willing to take those payments, but also there's a $500 billion cut in Medicare. That's a 10% reduction over 10 years in the Medicare budget. At the same time that 30% more people are going to be enrolled in Medicare as the baby boomers age. Those numbers simply do not add up. 10% fewer dollars, 30% more people. What it's going to mean is fewer hip replacements, fewer knee replacements, fewer bypass surgeries, fewer angioplasties. Those are the four procedures that have virtually transformed the experience of growing older in this country. People used to be trapped in a wheelchair because they were so crippled by arthritis and bone deterioration, or they would be stuck in a nursing home because they were so short of breath from clogged arteries. Now we're able to free older people from these maladies and let them enjoy their later years. Obamacare is going to undo that.
And there is no better summary, in my opinion, on everything that you just said with respect to those doctors than in your New York Post article, Deadly Doctors, Advisors Want to Ration Care. You can Google it. Just type in Deadly Doctors. It'll take you right. It's the first thing that pops up on the Google search on the New York Post website.
Yes, and here is an op-ed piece that was written by a doctor in San Francisco, Catherine Dowling Schlereth. It appeared in the San Francisco paper, and it's referring to House Bill 3200. And she writes, advanced care planning consultations and other provisions of this act frankly scare me. As a physician, I took an oath long ago to put my patient's interests above all else, but provisions in the bill have a quality of coerciveness that makes me wonder if I can fulfill my oath.
Well, and then that goes right to what you've reported about Dr. Ezekiel Emanuel, who's saying, there's a problem with you doctors. You take this Hippocratic oath way too seriously, and that Americans need to get a life. No pun intended.
That's right. He's saying doctors should focus less on the needs of their own patient. Of course, that's what we always want our doctor to do, focus on our need. Focus less on the needs of our own patient and consider other issues, such as whether the money that's being spent on this patient could be better spent on the younger patient down the hall or maybe on education or the arts.